and that the rightful response would therefore be a collective one. Accordingly, even as early as 15th March 2020, Prime Minister took the initiative to hold a meeting of SAARC heads of governments to fashion a regional solution. An important outcome was the creation of the SAARC COVID-19 Fund that supported early exchanges on this issue within the region. We then held workshops and training courses to strengthen capacities for handling vaccines and other aspects of public health and COVID-19 management. Most recently, that was followed up by a meeting of senior health officials of the region on 18 February 2021. They shared the outcome of their deliberations with the Prime Minister, who urged a special visa scheme for doctors and nurses, coordinating a regional air ambulance agreement, a platform for studying data on the effectiveness of vaccines, and a network for technology-assisted epidemiology for preventing future pandemics. Sir, our efforts, of course, went well beyond the neighborhood. When it came to online training and capability building, the Ministry of External Affairs conducted 14 e-ITech courses in partnership with premier institutions like AIMS and PGI Chandigarh. There was even an exclusive one conducted in Bangla for Bangladeshi professionals, and one by our Armed Forces Medical Services for military doctors in Southeast Asia. These 14 courses had a total of 1131 professional participants from 47 countries. In planning and executing Vaccine Maitri, we are naturally guided by a determination to make a difference at a difficult moment in global society. Our reputation as a pharmacy of the world has been reinforced in that process. So indeed has the faith in Make in India. But more than the vaccines themselves, our policies and conduct have emerged as a source of strength for the stressed and vulnerable nations of the world. They can see that there is at least one major nation that truly believes in making vaccines accessible and affordable to others in dire need. The House should be aware that the supply of vaccines abroad is based on the assessment of adequate availability at home. This is continuously monitored and takes into account the requirements of our domestic vaccination program as it unfolds in different phases. An empowered committee oversees this entire process. Quite appropriately, Vaccine Maitri began in the immediate neighborhood, starting with the Maldives, Bhutan, Bangladesh, Nepal, Sri Lanka, and Myanmar, as also Mauritius and Seychelles. The extended neighborhood followed thereafter, especially the Gulf. Supplying smaller and more vulnerable nations was then the logic of reaching out to regions from Africa to the CARICOM. There were also contracts that our producers had entered into with other nations, either bilaterally or through the COVAX initiative. To date, we have supplied Made in India vaccines to 72 nations across geographies. Sir, the House should recognize the enormous feeling for India that our initiative has generated. Those sentiments have naturally been expressed by leaders and prominent personalities of many nations. But more than that, our ambassadors abroad feel every day the warmth of ordinary people across the world for India. In the truest sense, this has been people-centric diplomacy at work. The world sees not just the selfless outlook of India, but also the quality of our products and of our capabilities. The COVID pandemic has been a test of fire for all of us, but I can confidently state, sir, that even in the midst of a global crisis, the Prime Minister's initiative of such deep friendship has raised India's standing and generated great international goodwill for all of us. Thank you.
We all are proud of this Maitri. Okay. Dr. Rajashri Malik.
Honorable Chairman Sir, मैं आपका बहुत आभारी हूँ आप मुझे इस मौका दिया बोलने के लिए. As you know, the Ministry of Health and Family Welfare is an Indian government ministry charged with health policy in India and has two departments, Department of Health and Family Welfare to implement health schemes and regulating medical education and training,